Hi, I'm Jessica and I'm one of the technicians here at Dove Lewis, and today I'm going to talk to you about how to give sub-Q fluids to your dog. First, we're going to talk about our sub-Q fluid setup. So you would have a bag of fluids. Ours is lactated ringers, or LRS. That's usually what we use for sub-Q fluids, though it may be different at your veterinary clinic. And we would send home a already spiked bag with a fluid line or drip set and a needle on the end. Our rule of thumb is that usually we will leave the dirty needle or the used needle on the bag, and so every time we go to give sub-Q fluids, we'll just change out that needle. So to do that, you'll take and make sure your cap is well seated on the end of your drip set. You'll untwist them. There's a little lure lock on here. Pull that off and put that in the sharps container, and then you will open your new needle, insert, and twist that on so that that stays on well. Be careful when you're pulling the cap off because it can give you a little bit of resistance and you could pull too hard and come back and poke yourself. So to read these bags, you will see that there are lines on the side of the bag. And depending on how much you are prescribed to administer to your pet, you will kind of gauge that by the lines. Each line represents 100 mils. So this is a 1 liter bag or 1,000 milliliters. So from here to the number 1 would be 100 mils. If we got to the middle of between 1 and 2, that would be 150 mils. And the way that you would do that, because these will start to fold over as the fluid level gets lower and lower, is a little makeshift way that you can hang these up so that they read nicely is to use a hanger. So you can put a hanger on the end and hang this up. And that way you have gravity on your side, and you'll just want to make sure that you take it down to read where the fluid level is at. Now I'm going to demonstrate how to administer sub-Q fluids on our canine friend Wesley. I've already changed my needle out and I have my line clamped. So I'm going to tent Wesley's subcutaneous area. And if I've done this in the past, I would choose a different area to give these fluids, just maybe moving it over slightly on his shoulders. But for demonstration purposes, in between his shoulder blades is a great area. You can see that he has some extra skin here. And when you tent the skin or pull up on the skin gently, you can feel like here that that's where we're going to be inserting our needle. So very carefully uncap your needle. Sorry, Wesley. And then you're going to just slide this into his subcutaneous area right there. You might feel a little bit of like a pressure and then a pop through, and then it should be in his sub-Q area like this. Next, we will unclamp our line. There's a rolly clamp, and I also have done the pinching one too. You can choose to do one or the other or both. And then you will make sure that the fluids are going. You can kind of see that they're dripping in the drip set. And if you need to, you can readjust if they're not flowing well. Once you've reached your desired amount of sub-Q fluid administration, you will then stop your fluids by either rolling the clamp down and or clamping the line like so. You can now use a piece of gauze or a little hand towel or just your fingers to kind of pinch off where that needle is inserted to his subcutaneous area and slide that out. And then you can just hold a little pressure, praise him for doing so well, and see how if that sits nicely in there. You might have a little bit of leaking, and if so, you can just apply pressure for a little bit longer. Again, the fluids may migrate to maybe his armpit area or lower on his back, and that's totally normal. Those will be absorbed within roughly 24 hours. And that is how you give sub-Q fluids to a canine.